Okay, great. So we are going to record this session. Just let everyone know so we can make it available to others. Well, I have the privilege of welcoming everyone today. This is for HPSM staff and also for our provider community to this webinar celebrating Black History Month at HPSM. And I'm just going to make a few opening comments so we can move to the next slide. I think, am I controlling the slides or is it, I don't think I have. Oh, great. Thank you. I'll just say next slide if that's okay. So I'm going to go for a few slides and I'm going to pass it off to Michaela here, who's going to take us through the majority of the presentation. Then I'll join you all at the end. And so in starting off, what I want to do is if you go to the next slide, while I'm doing these initial slides, please everyone in the chat, especially those in the provider community, please let us know your name, the organization that you're with, and what brought you here today. And all of those would be super valuable. So not just name, but organization and what brought you here today. We're also going to come back to that at the end. So think about during this hour that we have together, what kinds of things you liked about this presentation, what you liked about the information, what you'd like to see more of, what you'd like to see less of, because this is really a journey that we want to be on, again, with our employees, with providers, and with the community for months and years to come. So we want to build on each experience to improve it. So if everyone could use the chat to do that, we can move to the next slide. And I won't read each of these, but just in reflecting leading up to this session today, it seems like something that I just have to mention right at the beginning. Goes back to the time that I first joined HPSM. I've been here about 5.5 years and newly the CEO, but have been here in another role prior to that as a deputy. And one of my very first meetings at HPSM was joining the provider relations team at our physician advisory committee. So one of my first meetings at HPSM was at San Mateo Medical Center in a conference room, a boardroom, where I had the privilege of sitting right next to Dr. James Hutchinson, who I'm sure many of you know of, who recently passed away. So one of my first meetings and one of my first memories of HPSM, and I did not know his history of over 70 years of service as the first African-American physician in San Mateo County, and the wonderful things he's done for the community and service he did through the community. And that was one of my first meetings. And I remember talking to him during that meeting and then after the meeting and meeting him at subsequent meetings. And I think for many of us who got to know him through that committee, I think this webinar, this session to me is really in honor and in tribute of him and to many others. And so I think of him joining us here today for that. So for this slide, this is our celebration of Black History Month, and it's also part of a larger journey. And those of you who are employees at HPSM hopefully know this by now, and those in the provider community, we are doing a lot of work at HPSM, both internally with our staff, understanding through our membership, the wonderful diversity of our membership and of the community that we serve here in San Mateo County. Part of celebrating that diversity is also understanding the diversity, and part of that is understanding disparities that exist in the historical context and this diverse community that we're a part of. And today is really about our members and the community who identify themselves as Black and African American, and really understanding their participation in healthcare in our community and what that looks like. We'll look at it from a quantitative, Michaela's going to look at it. We have information from a quantitative standpoint and also from a qualitative standpoint. And our journey on this is going to be ongoing through work that we're doing, again, internally and externally with you as partners. So we look forward to that. And then if you can go to the next slide. really just what I wanted to end with is that I think the way that we want to approach all this work is with you, is with the community. Again, whether it's work that we're doing internally with our staff or with members or with providers or with the community, and to learn together. And we want to continue to do that, which is why we want your input of how to continue to do these, how to continue to improve as we go along. And what I really appreciate before I introduce Michaela and pass it off to her, and really a lot of people on her team and that she's worked with in here at HPSM, is I want to really acknowledge and appreciate the work that they're doing, that she's doing, that others are doing, because as you'll see in this presentation, the approach is one that we want to take in all aspects of our diverse population here at HPSM, and that is you're going to see quantitative information. What does the data tell us about what is really happening? But then there's also an emphasis on qualitative information and the experience of our members. So not just looking at data, not making assumptions that we know everything about what should be done. In fact, one of the biggest things that we can learn is to use this information to identify the things that we don't know and need to find out, the assumptions that maybe we make or have made in the past that we need to reassess. And what I really appreciate about this team's work and everyone who's doing this work is that fundamental questioning of the information, questioning our own assumptions and moving forward, and not being afraid to talk about issues that are uncomfortable. So we invite all of you, again, whether employees or in the provider community, to join in that conversation today and along in the future. And with that, I will pass off to Michaela.
Thanks, Pat. Yeah, I thank you for that shout out, and I do want to just credit my team for helping us put this presentation together and really giving it really intentional thought. So thank you to my team and everyone who helped contribute to this presentation. And yeah, super excited to get to speak with providers today and some other HPSM staff that joined as well. So very just happy and humbled by the amount of interest in this presentation. And yeah, so let's jump right in. So I'm just going to go over some disclaimers and agreements. So as Pat said, this is going to be, a difficult conversation to have. It will be a conversation about racism, specifically in the medical industry. And what we're talking about isn't easy, and I do want to give that space. And so some participants may be feeling bad or guilty or other negative feelings depending on how you were raised and how you identify and how you walk through the world. So everyone's participation is huge. And I just wanted to give people the space to take that in and know that it's going to be a difficult conversation, but that, we can work through it together and really lean on each other during this presentation. So I put together some agreements. The first being to just be present, so engage in active listening and be aware of your thoughts and feelings in the moment. The next one is to respect and honor silence and confidentiality. So don't feel pressure to share whatsoever, but what is shared should remain confidential within this group. And I also want to just emphasize that there will be moments of silence during this conversation, and silence isn't always bad. It just means people are thinking and reflecting. And yeah, I'm definitely going to give space for the silence so that people can take in all this information. The second one is to express and presume welcome. And by that, I mean that, it is going to there are going to be difficult conversations, but learning often comes through our own discomfort and risk taking. By avoiding conflict, we, can keep others comfortable, and you may miss the opportunity to authentically engage with others or further your own understanding. And so, I just want to recognize that. And by centering our work on our shared goals and values and approaching this conversation just with respect and generosity. And we can just continue to establish a brave space and continue to establish a space that furthers our shared learning. The fourth one is to speak your own truth and let others speak theirs. So different perspectives are welcome and encouraged. Speak from your own lived experience and not from experience that you do not personally have. And because your normal might not be other folks' normal. So, sharing is encouraged and we would love to have the participation. But speak from, what you know, and also be open to hearing different opinions and different experiences that other folks might have. And the last one is no one knows everything. Together, we know a lot. So that's, again, just shared learning is a practice in humility. And because we have something to learn from everyone in this room, it also means we all have a responsibility to share what we know, as well as our questions, so that others may learn from that as well. And just to honor these disclaimers and agreements, I just want to mention that we will be recording, as Pat said, but we will stop recording when we get to the Q&A section of the presentation. And so I really urge you to write down your questions and comments and save them for the end, so that we can stop recording and really engage with the material in a safe and confidential space. Next slide, please. Okay, so the history of African Americans in the U.S. and healthcare industry. I thought this quote, really kind of drives home this point. So people think of race as a biological factor in health outcomes when it is not. While the effect of racism on health is well established, progress will take time and has to occur on a societal level. There has to be a systemic change because racism, not race, has a profound impact on our health outcomes. And this quote was given by Jacqueline Duget, the medical director of the Howard County Health Department in Maryland. I think what is most important to take away from this quote in this presentation is that, as Dr. Duget said, the problem is not race, it is racism. Everyday micro and macroaggressions have led to what we have all been taught to believe are flaws that are exclusive to Black bodies. And Black people are not inherently more likely to have poor health outcomes. They have poor health outcomes because of the systemic oppression that they have had and still have to endure on a daily basis. And while we might be talking specifically about the health of our Black member population, remember that disparities or poor health outcomes that you see that differ from the greater population are because of a broader systemic problem within the medical industry and in the US. So I just wanted to say that before we jump into the rest of it, that it is a conversation about racism. It is a conversation about institutionalized and systemic racism, but to put focus on that rather than the race. Next slide, please. Okay, so how did we get here? So since the 18th century, doctors and scientists have created and perpetuated racial inferiority mythology and stereotypes based in race. Centuries of slavery with accompanying biased educational processes almost inevitably led to medical and scientific abuse, unethical experimentation, and overutilization of African Americans as subjects for teaching and training purposes. This has not only caused physical harm, but intergenerational harm and internalized racism within the Black community that still impacts African American communities today across the US. Black Americans still carry that burden of unethical medical practices and structural racism. There was, of course, the Tuskegee experiment, which involved 600 Black men without their informed consent. And there's also Henrietta Lacks's tissue, which scientists are still using in their research today. And there are also more recent examples of this, that we should shed light on. I think we can all look at COVID-19 in Black communities in the US. The continuous lack of care for Black bodies has created a lasting distrust between African Americans and the healthcare industry. Vaccination rates, infection rates, death rates have all been disparate in this group. And we can also put a spotlight on maternal health disparities in this population, as well as food deserts, hypertension, and the list really goes on. Next slide, please. Okay, so now I'm going to go into the population characteristics that we can see from measurement year 2020. You can go ahead to the next slide, Julian. So many of our Black member population is between the ages of 22 to 50, as you can see here. So we don't, you know, that is the majority of our population. And if you guys are interested in further breaking down that category and interested at looking at specific measures, again, we have questions for the end, so please just save them and then we can talk about kind of where to go from there. Next slide. So as with other ethnic groups, most individuals identify as Black are in the lower risk group. So lower risk category here, you can see that there are some, you know, medium risk and in the high risk, but the majority of members are really in the low risk category here. And we can see that, you know, and just in general, the amount of members, you know, getting assigned to case managers and things like that are lower than the other race categories. Next slide, please. So members diagnosed with chronic conditions. So, you know, members who are identified as Black, diagnosed with chronic conditions, are identifying most diagnosed with neurodevelopment disorders, asthma, and obesity, which are also the main chronic conditions seen in larger race and ethnicity groups, such as our Hispanic identifying member population. So we can see that here as well, that those you know, conditions, neurodevelopment disorders, asthma, obesity, continue to be an issue, a disparate issue in this population as well. Next slide, please. Okay, so as you know, as with other ethnic groups, most individuals in the Black population, we are seeing booster rates for members identifying as Black is higher than the national average for those individuals that live in California. I think what's most important to take away from this slide is, as I said before, vaccination rates in the Black community are consistently lower in the Black member population when compared to other race and ethnic groups. This is consistent with state and wide national data. Initially, research and media outlets attributed this disparity to a distrust in the medical industry and in the intentions of the government, and overall lower rates of intention to get the vaccine in the Black community were found. However, more recent studies have shown that the intention to get the vaccine is actually comparable to other racial and ethnic groups, but that the consistently lower rates have to do with systemic issues like lack of access and other structural barriers such as that. And I just want to say, overemphasizing hesitancy diverts attention away from the policies that could fix those access problems and that could potentially stop the hindrance of the U.S. vaccine distribution strategy at large, and especially for the Black community. And while hesitancy is still a concern, and while mistrust is still a concern, it's important that we continue. It's important that we continue to shed light on systemic issues that can be addressed instead of focusing on a one-story narrative that can actually further perpetuate those systemic barriers. Next slide, please. So these gaps continue, although nationally since January the differences are getting narrower, we are not seeing the same in our current data. Again, this can be due to a lack of access and other systemic and structural barriers that prevent Black identifying members from getting vaccinations. Our partnership actually with Wider Circle has shown us that fear, medical reasons, and not having enough information about the vaccine as a potential roadblock as well. So make sure you're making an active effort to connect your patients to resources that can help them in getting up to date and foster open communication, to give them the space to ask questions and to really understand what is available to them and how the vaccine will impact their body and their livelihood and things like that. Next slide, please. Okay, so maternal health, I just want to take a pause and stress the importance of this slide, and also plug that we will be doing more for maternal health in April for Maternal Health Week. But the maternal health has been and continues to be a concern among Black mothers and children. Rates for C-sections, gestational hypertension, prenatal and postpartum care continue to be lower than overall rates. There are multiple reasons for this, including historical contents, experimentation on Black women, for one, access to healthcare, socioeconomic status, incidence of pre-existing conditions, medical racism, abortion access, all of which are social determinants of health in the United States. And what we've heard from other community partners is that the main issues that Black mothers are having with having their babies and having healthy pregnancies is not being listened to when they have concerns. This can lead to complications and death in many cases. I think the most important thing to remember here is to treat the patient like the expert of her own body, because she is, right? And I think it's just really trusting what the patient has to say about her body, trusting that she knows the most about her body, and allowing her to take a really active role in her health journey and in her pregnancy journey. Next slide. Okay, so just to take a look at this in terms of HEDIS measures disparities. So we are seeing higher rates for members identifying as Black for the following HEDIS measures. So we've got CBP, we've got chlamydia, we've got CIS, which is, I believe, 10 child immunizations. And then we have Well Child 30, that's the 6 well child visits in the first 30 months of life, well child visits in the first 15 months, or 6 or more well child visits in that time frame. And then we are seeing lower rates for our members identifying as Black for these measures. So we have Well Child 30-2, which is, again, well child visits in the first 30 months of life, visits for age 15 months to 30 months, and then 2 or more well child visits. We are not seeing rates that are as great as these above here for that. We also have disparities in breast cancer screening and cervical cancer screening, and you'll be seeing some programs coming out that try and address that a little bit more. Next slide, please. Okay, so this is what we're hearing from members, and this is, I think, what Pat was, alluding to at the beginning of the presentation, where we don't want to just look at the quantitative data here. We also want to look at what members are saying, what their experiences are, and what their lived experiences are, and how that impacts, their medical journeys and experiences when going to see their doctor. So overall, we're just seeing less awareness of community resources, and that kind of speaks to that lack of access that I mentioned before, and concerns about receiving inadequate treatment or being used as experiments. And this is a very, very valid concern that many Black identifying people have across the country. So I think it's just important to really be aware of that, and allow your patient the space to ask questions and challenge and do all of those things so that they can really understand, what is going on with their health journey. In terms of treatment, there's differential treatment due to Medi-Cal coverage. We've heard that before. There's rude or dismissive behavior from staff, and this is staff at all levels of care, right? This is staff at the front desk, a nurse, a provider, all aspects of the care experience. The provider doesn't always explain things in a way that's understandable. So again, this just speaks to giving your patient a lot of space to ask questions and really understand, what you mean and what would be best for them in their journey. And it allows them to take a more active role and step in understanding what their, choices are and how they want to move forward. And then the last one here is that the provider doesn't always spend enough time with the member. I know that providers are so busy, right? And scheduling can get so difficult. So here I would just say, schedule as you can, right? And just really be present for the time that you can have with that member, and offer more time if that's possible. Offer another appointment or another consultation to be able to really drill down into the details, and help patients understand. As far as the COVID vaccine, we are hearing some folks just are misinformed about the effectiveness of the COVID vaccine. They're hesitant to get the vaccine due to medical reasons, fear, mistrust, and just needing more information. And again, this speaks to that lack of access, systemic barrier. I think, if your patients have questions about COVID, the vaccine in particular, to just, provide them as much resources as possible and be there to answer any questions that they have. The bright spot in what we're hearing from members is that 92% ranked personal doctors as a 7 out of 10 or higher, which is great. That's really great. It means that, for the most part, our members are having a positive experience with their providers. And I think, our providers also took the time out of their day-to-day to really understand what's going on in the Black member population. And I think that's what all that Black identifying members are asking for, is to just be understand and listened to. So great job on that. Next slide, please. Okay. So improving care for Black identifying members, from our conversations that we've had with our members, again, providers, community partners, we are hearing a call for more transparency. So from start to finish, staff should be trained in creating a welcoming environment from reception to nurse to doctor to pharmacist, etc. Working with in tandem with all steps of the patient's medical experience, as well as keeping the patient in the loop. Again, it's important that doctors and providers remain, transparent with the patient so that they can really understand what it is that's happening and how that impacts their, overall life and their overall health journey. And I think members are just asking for some space to be able to do that there. We've also heard a need for improved customer experience. So always making sure the experience is patient-centered and creating space to allow the patient to understand and being an active driver in their health journey. This also leads to increased medication adherence, improved health measures, a myriad of other things that just improve health measures, customer experience, and overall quality of life. So I think that putting a real emphasis on the experience that a patient has when they walk in is definitely going to help with this transparency piece. And then the last piece, and I think this is a big one, we really need to be attentive to trust. Trust is reciprocal, right? And trusting the patient builds the trust back with healthcare, I think. the healthcare industry and the history behind it doesn't give much confidence to Black members to feel like they are going to be trusted and that they are going to be listened to, as well as not wanting to give that trust back as well. And so I think just really being transparent and trusting that the patient knows what's best for their body and listening to what their body is telling them, I think is really important here, and it will help aid in that very long journey that it's going to take for African American members to really feel listened to and trusted, and feel like they can trust their provider as well. Next slide, please. Okay, so now I'm going to go into some resources for our Black identifying members. So we have some HPSM resources here. We have asthma resources. It helps members with asthma breathe easier by avoiding preventable attacks, and you can find that here. The Diabetes Prevention Program is a 12-month healthy lifestyle change program to prevent daily onset of type 2 diabetes, and that's a great program. You can find that there. And then the Diabetes Management Program has website resources, newsletters, and other information on our website. You can also learn more about any of these programs by calling the number below. We'd be happy to talk more about them with you, and just figure out what's best for the patient. Next slide, please. We have a couple more. We have COVID-19 Getting Vaccinated. So this resource helps members find vaccine appointments close to home. And then the COVID-19 Vaccine Hesitancy resource to help you build vaccine confidence with your patients. So if you're finding that your patients really do need some extra space to understand the vaccine and its effects and how it can and how they can get access to those things, these are great resources for that. And then lastly, we have a hypertension resource. It's clinical guidelines to support members with hypertension and high blood pressure, and we can see that that is high in this population. Next slide, please. And we have two more. We have maternal health, and those resources is to close the health disparity amongst Black infants and mothers. Again, we will be doing something more in April during Maternal Health Week to talk a little bit more about this, because it is such a complex topic, especially for Black mothers and children. And so, stay tuned for that, and we're super excited for that. But these resources are very helpful in the meantime. And then we also have an obesity program and weight management resources for members struggling with obesity. And all of this can be found, all resources that I mentioned can be found on HPSM's health tips page. It's on the member side of the website. So if you'd like to take a look there, you can also direct any patients that have any questions, and want some more resources that are printable and that they can take home. They're there for you there. Next slide, please. Okay, so we have some community resources here as well. So we have the Bay Area Community Health Advisory Council, which works to eliminate health disparities across generations and communities through education and services. I really love this resource because it focuses on the intergenerational aspect of good health and good health outcomes. And really aims to kind of mend the intergenerational trauma that African American members and people across the country have to experience. We also have a Black infant health program that aims to reduce the infant mortality, low birth weight, and sudden infant death rates in the African American community, and it focuses on infants and mothers. So that's a really good program as well. Next slide. We have First Five, which is committed to creating an opportunity for all children in diverse San Mateo County. They have a lot of different events that go on, so I definitely suggest visiting their website to see what events they have, and they could potentially be helpful for some patients that you might have in mind here. And then we have the SMC African American Community Initiative, which supports African American San Mateo County residents who are having trouble finding and utilizing mental health services. This is so important. I think mental health, in the Black community is often not talked about, and there has been a recent push to kind of just get Black members in therapy and utilizing mental health services. So this is a really great resource. I encourage everyone to take a look at this one. This one is super important. And yeah, just continue to plug mental health resources with your patients. Okay. So for any additional learning, AACI Black History Month event on Saturday, which is, this Saturday at 10 a.m. The topics are COVID-19 disparities and healing-centered engagement. So for any additional learning that you guys want to do, this is going to be an excellent event. So please just check it out. And exciting to see. Next slide. Okay, so I think we're going to stop recording at this point.